We are physicians first. I mean, we're here to take care of our patients first and foremost, even put concerns of theirs. We try to address everything and make patients feel better, happier, and healthier.
I mean, the number one thing is patient safety. From the moment you step foot in our office to the moment you leave, our primary goal is your safety, no matter what you're coming in for. So even the biggest names in plastic surgery still think that breast implants overall are safe. Breast implants are probably the most studied medical device in history because they are so common. Absolute leaders in the field of plastic surgery, and they have evaluated all the evidence and found that they are overwhelmingly safe.
Welcome to Plasticos, the everything you ever wanted to know plastic surgery podcast with me, Dr. Christopher Park, and host Kim Anderson. We will discuss surgical and non-surgical plastic surgery options and the ways that they improve your health, mood, personality, and success.
Welcome to Plasticos, everyone. I'm Kim Anderson, along with Dr. Christopher Park and Dr. Ryan Rebowe. And gentlemen, it's October, which means it's Breast Cancer Awareness Month. And so a lot of people have questions mainly about breast implant safety and some diseases that may be associated with it. What we're going to do today is we're going to kind of debunk some of these myths that are out there. One that we've talked about was that implants can rupture. So people are saying stay away from implants because they'll bust inside your body, but that's not necessarily the case.
Yeah, I mean, certainly in my career, I've dealt with ruptured implants, but a lot of those are the older implants. So for the back history on silicone implants, initially the first implants used were silicone. There have been a bunch of other things tried, but it kind of came back to where silicone was the best. And that what I mean by that is there's a silicone shell, even if it's filled with salt water or saline, or whether it's filled with silicone gel. Silicone was pulled back in the early 90s after a Connie Chung Dateline episode about a few women that had had autoimmune disease after their implants were put in, and it kind of caused a big stir, and the FDA pulled them and called for increased research, which we support, and we kind of lead the show on trying to keep things safe and researched. So they were pulled, but then they were extensively researched. Lots of research and development money was spent, and it was determined that they were safe. I mean, the risk of most of those conditions is no higher in patients with implants or without. So there certainly seems to be more coincidence than causing issues. And then in terms of rupture, what great thing that came out of that is the implants that were made and the companies that invested the money necessary to get through this FDA training and research protocol and approval was really just two companies initially. Now there's a third. Tons of money, billions of dollars of money spent on researching these implants. And so they are made so much better now. Initially, there were numerous companies, 10, 15, 20 companies making implants, and they would not do a ton of design, and they were putting them in, and they were trying to make them as soft as possible, so they'd put a thinner shell and a more liquid silicone. And back then, yeah, we would see ruptures. They wouldn't last more than 10 years without rupturing. Silicone is a solid silicone gel wrapped in a silicone core, and if it were to rupture, we do want to clean it out. You know, it's a sticky kind of substance. It's inert, doesn't really interact much with the body, but it will cause an inflammatory response. So we tell people it's about a 1% risk a year.
Well, the big thing, too, is, people think, so this implant busts and it's just going to, flow out all over my body and I'm going to have silicone everywhere. As Chris already alluded, the silicone these days is what they call more cohesive. It sticks to itself. It doesn't like to run out of wherever it is. And so if you just took a breast implant, put it on the table and cut it in half, the silicone wouldn't run out of the breast implant. I mean, it may just very, very, very slowly fall out, but more or less it likes to stick to itself. So that works in our favor a lot. The other thing that works in our favor is that your body creates this natural capsule around the implant. And I know that we talk a little bit about capsular contracture. We may get a chance to talk about that later. But the majority of capsules are not pathologic. They're a very normal, natural response to the implant from your body. And they actually help us in these very, very rare instances of breast implant rupture, because the majority of these ruptures are what we call an intracapsular rupture, meaning that even if a little bit of silicone does escape from the implant, it is contained within that capsule. And so it doesn't go anywhere in your body. It doesn't get absorbed into your tissues. Between the way that the silicone sticks to itself and the capsule, it's very rare that you have an extracapsular rupture where you have silicone kind of, leaking into your tissues these days. Again, the majority of the cases that we see from that are actually from old implants. And you ask how old. I mean, I'm 33 years old and I've taken out several sets of implants that are older than I am. Implants will and can last for a very long time, even though the average lifespan of an implant is around 10 years.
Okay. Now, you two decided that you were going to do a little experiment on breast implants. Let's talk a little bit about that.
So as Dr. Park already mentioned, we get a lot of questions about rupture, not just, preoperatively when we're talking about doing breast implants, but you would not believe, people will rush into our office because they say, oh my gosh, I was opening a drawer and I hit my breast on the drawer and now I think my implant's ruptured. And it's really hard to explain, because we had no way to quantify how much force it takes to rupture breast implant. And, Dr. Park's daughter is very active. She plays a lot of sports. And so one day we took some of the breast implant samples that we had of these fourth generation implants, and fourth generation are not the most cohesive or the gummy bear, but they're kind of one step below that because we didn't, the gummy bear is a little bit of an unfair advantage. But we decided to play some softball with the implants. And so I think I was
starting to laugh.
Yeah. Well, Chris, he's a little bit embarrassed. I think I hit 5 for 5 and Chris, I think, went 3 for 6.
That's true. That's true.
We did it with all these different types of implants from the different manufacturers. All were fourth generation. And we hit them as hard as we could with the softball bat. And I think we only had one rupture, and that was in the oldest implant that we had. Some of these implants are 12 years old. I think the one that ruptured was probably from when Chris very first started practice.
And Ryan was 5 for 5 because he was swinging at about 80% strength. I was swinging 100% strength. And, literally...
Which is still harder than Chris's 100%, just to clarify.
Yeah, literally swinging as hard as we could with a true baseball bat, pitched implant. And the only one that did rupture, but like he said, this is not filled with liquid silicone like they were in the 80s, which was kind of like vegetable oil. A small little hole and it could leak. And sometimes it even leached through the surface of the silicone shell, so it wasn't actually ruptured, but you still got a big inflammatory response. The new implants, they're solid, and so this one, even though it ruptured and rolled across the yard, it still was all together.
Oh, wow. So they're pretty much safe. That's not something that you should keep you from having the surgery thinking that, all right, if I fall, then my breasts are going to explode.
Yeah, it would take an extreme amount of force, a major car wreck or some sort of major trauma. And even the older patients, Ryan's mentioned it. We see patients that come in with a rupture if their implants was put in 1975, and it took a major force or it's been ruptured for a long time. So most of these patients will come in and they will tell you, my breast has been hard as a brick for 15 years, but it just got softer, so I think it ruptured. No, so again, old implants not necessarily made that well. So it was ruptured the whole time it was hard, most likely. And then, maybe the capsule that Ryan mentioned, the natural biological capsule our body formed, may have gotten a hole in it and it finally softened. But it's been leaking for a long time. So if anybody has hard implants when they come see me with those old implants, I tell them it's ruptured now. It's not a matter of waiting for it to rupture.
So if someone had an implant put in back in the 70s or 80s, should they go get them checked periodically? How often should you get an implant checked?
We tell all our patients to come in once a year. Of course, people don't even see the regular doctor once a year usually. So, they're not great at following through with that. But that's what we ask, and we're happy to see people that had their surgery elsewhere, and we're never going to force somebody to have surgery, but there certainly are people that we can tell it's ruptured, and it's causing inflammation, and it may be causing some discomfort. And we can take it out. We can take it out and replace it. We can take it out and replace it with something else, an implant or fat or whatever we want to do. But
And one of the things people ask often, they come in and, of course, having surgery is not a small deal to anyone, obviously, and a lot of people want to try to avoid it at all costs. And we frequently get asked if there's any step in between, likely implant rupture and going to surgery. And the best way to diagnose an implant rupture is actually with an MRI, which, one, is not the most pleasant procedure, but also is not going to be covered by your insurance unless you've had breast reconstruction, and in which case it will be covered. But if you have cosmetic implants, an MRI will not be covered to check for an implant rupture. So, the more common thing to do, I think Chris and I are both fairly good at diagnosing an implant rupture, is to go in and swap out your implant at that point and remove the ruptured implant and, either replace it with another implant or replace it with autologous fat. We can do some fat grafting or just do a breast lift if you don't, want to have an implant anymore.
So there's several options now. We were talking earlier today about some social media sites that are out there when they talk about the negative effects of getting implants and, big followings. And some of the stuff that's being put out there is not necessarily true.
Well, we don't kind of get into the true, not true discussion in that there are people that have symptoms that they will attribute to their implants. whether they started recently after or they've been to multiple doctors and nobody can figure anything out, but they just don't feel right or they're having symptoms. And, if you look at these symptoms, a lot of them are very common kind of things. Not able to sleep, poor appetite or excessive appetite or losing hair, those sorts of things, and a whole laundry list. And there are some people that are attributing this to something called breast implant illness syndrome, which it's not been scientifically validated that it is a condition. But what we see from patients is that they just don't feel right and they're tired of going from their regular doctor to their OB to a rheumatologist to all sorts of people trying to get help, and they feel like A, nobody can figure it out, and B, nobody will listen, and sometimes they even feel like people don't care. I know a lot of doctors, and I can't imagine doctors that don't care, and certainly the two of us sitting right here are not in that category. So if we see a patient that honestly feels like they have something that's related to their implant, we're happy to listen. We're happy to take that implant out. You probably want to take the capsule out as well, surrounding the implant. And we hope and we pray and we hold hands with you and hope that it helps your symptoms.
I would say that in terms of breast implant illness, I think a frustration from many women is exactly what Chris just said in terms of seeing a number of different providers who dismiss their symptoms. And the reason for this in the plastic surgery literature is that these symptoms are common to lots of different other issues. You're talking about symptoms that are common to fibromyalgia, depression, anxiety states, other things. Aging. I mean, even just going through menopause can cause some of these symptoms. But a lot of women feel like just that cannot explain these symptoms. And I think that the common belief is that, breast implants are a very common thing. I would say not, just in the community, in the medical community, even having breast implants is not uncommon. And so a lot of women feel like if you go see your primary care provider, you go see your OBGYN, they should know what to do with breast implants and these symptoms. But in reality, I think sometimes you really do need to see a plastic surgeon who, again, will really listen to you and kind of understand your symptoms and understand what you need to be worked up for. I mean, even looking in the plastic surgery literature, this is not something that's totally dismissed as something that's unvalidated. I will tell you that we do not have any studies absolutely 100% proving that these symptoms are attributable to breast implants. But what we do have is studies showing that women who do have some of these symptoms should be worked up for rheumatologic conditions and other things that could be causing them. And there's literature to show that removing breast implants can help these symptoms, although it does not always do that. I mean, you're talking about, in terms of a true breast implant illness, a very, very small percentage of women. I mean, you're talking a very, very small. Can't tell you exactly a number, and the problem with that is, if you say, okay, 1 out of how many women, right? So 1 over how many will get these symptoms. The problem comes in that denominator, trying to figure out how many women have breast implants. There's just no really registry, believe it or not, to say, X number of women in this community have breast implants. We know it's very common. We know that the overwhelming and vast majority of women have absolutely no issues with their implants. But we do know that on occasion, there are women who benefit from having their breast implants removed. And again, I think sometimes it takes going to a plastic surgeon, especially one who is kind of experienced and has seen some of the stuff before, to know sort of what to do and what the best way is to move forward.
And what is the average lifespan of an implant?
We use the old data, which would say 10 years, although I think it's far longer with modern-day implants. And the main thing we see with these patients who want their implants removed is I spend a lot of time and effort educating them on the fact that the breasts are not going to look how they looked before their implants were put in, if it's been 20 years and they've had children and gone through menopause and all these things. So that, that's one main thing, is just realizing if you simply just remove the implants and the capsule with them, it's going to be like undergoing, pregnancy and then not being pregnant, or massive weight loss. And they're going to be deflated. They're, probably going to have some sag, some droop, some ptosis. And simple removal may not leave a very good cosmetic result. So we have to prepare them for that, just mentally. And if they're okay with that, great, wonderful, fine. But we are going to spend some effort making sure you understand that. There are certainly things we can do at the time of implant removal or later to help them. You obviously can put implants back. You can change from silicone to saline if you're worried about silicone. We can backfill or fill the breast with fat. It's going to be much more subtle than an implant, but we can take fat from the other parts of your body, prepare it in a certain ways, and fill the breast tissue to add a little bit of volume back. We can do a lift So if things are going to be droopy and a little bit deflated and you lift them, they will look certainly better. So those are all things that the patient needs to understand, because I've had patients that think, well, my breasts weren't bad before I had implants. I had them put them in when I was 22. I'm now 48. They'll probably look like they did back then. And of course, that's not true.
Now, covering different news stories, we've done some on breast implant recalls. Some people claim that they cause cancer. Let's hit on that right now.
Yeah, that's very important to hit on, because obviously that sounds super scary. Breast implants in general are safe, okay? And there's a variety of different types of implants. I mean, everybody knows the word saline and silicone, but there's different types of cohesivity, different types of fill, there's different types of shapes, there's different types of surfaces. So what this gets down to is that textured implants, which means the outside of the implant has some texturing or friction to it, are very valuable and helpful in a lot of situations, and very different than smooth implants. Smooth implants cause less reaction by the body. They just kind of sit there, whereas the textured implants have the little tiny bumps, either indentions or outgrowths, that kind of help the body latch onto it. And it kind of does that on purpose. It's trying to stimulate the immune system a little bit to hold it in place. And we know those implants don't move as much. And so they're valuable in a lot of situations, with reconstruction or when you're doing a lift at the same time. Now, in general, we don't use textured implants that often. Then there's different manufacturers of implants. And the three manufacturers in the United States are Mentor, Allergan, and Sientra. And they all have different techniques of texturing. Allergan, since I started plastic surgery back in 2001, has always been very proud of its texturing because it's the most aggressive type of texturing. And they used to talk about when you use it and you go take it out, it's almost like separating Velcro when you use your finger to separate the biological capsule from the implant. And it is known for that. And again, that's not a bad thing per se. But what has been discovered after studying this, across the entire world, millions and millions and millions and millions of patients with breast implants, that there is a very small risk of an immune-based cancer. Okay, so this is called a lymphoma, and we actually have a name for this called breast implant-associated anaplastic large cell lymphoma.
And that's a mouthful. So it's abbreviated BIALCL. So that is the term that you'll see referred to in the news and in plastic surgery articles and pretty much everywhere is BIALCL.
And so this is in the news, and you know what? It's in the news because we want it in the news. The American Society of Plastic Surgeons and other people have really helped fund this education. So basically what happens in a very, very rare situation, usually numerous years after implants, that are textured, and particularly with the Allergan texturing, the one breast will start to form some fluid, a seroma, and get a little bit larger, a little bit tighter. And we wanted patients to know to pay attention to that. So even though it's extremely rare, we're trying to make patients that may have had their implants 20 years ago and not talk to a doctor about them in 20 years know that if one breast starts to swell or look different, to have it evaluated.
Well, and that's part of that, what we mentioned earlier about coming in to see us every year to monitor your breast implants, right? We want to be looking for these things. We want to be checking for these things, no matter how small the risk or percentage is.
And a mammogram is not going to show that. You would need an ultrasound or an MRI to find fluid or physical exam. So very rare, but if it does present with fluid, which is, Brian has the numbers on it, but that's unlikely to present with a seroma, but then it can just be simply tested. And there's an immunohistochemistry test for certain CD30 that tells us if this could be going on. All right, so the backstory on that is, so with Allergan, because of their more aggressive texturing, and the way I explain it to patients is, all cancer basically happens from, as the cells go through their cell cycle, they can get off track. Essentially all cancer, that's what happens. So this is an immune-mediated cancer, and the more reaction you have by the immune system to your implant, the more cell cycles are going to occur, and the more likely that one time it might get off track. And so that's why this more aggressive texturing, which causes more of an immune response than other texturing brands, and way more response than a smooth implant, has a more likely risk of getting off track. And so it's 6 times more likely with Allergan texturing than with all the other texturing. The risk is still unbelievably low. I tell people there's about a 1 in 8,000 chance. And to put that in perspective, every single woman in the world has a 1 in 9 chance of developing breast cancer. So it's very unlikely, but we just want to keep our eyes out. And if you are diagnosed with BIALCL and you catch it early, it's usually just that fluid and tissue around the implant and in the capsule, and we can cure the patient with a complete capsulectomy, or some people call it an en bloc removal, where you remove the capsule, the implant, and basically everything the implant has touched, and you can be cured. If you wait too long, it may get in lymph nodes or whatever else like other lymphomas can. So we're all about education and keeping people safe. It is not something, in my opinion, that needs to scare people at all if you have smooth implants, and really not even that much even if you have Allergan textured implants. Our answer is you do not have to remove them. Let's just keep a close eye on you. If you want them removed, absolutely, we're happy to help. Even if you have that exact implant that was recalled, your risk is 1 in 8,000.
So just keeping them informed, not scared, but informed.
Right. All the scientific mumbo-jumbo aside about ALCL and immune responses and stuff like that, the real question that everybody wants to know is, what are my chances of getting this, right? So one, I think the important take-home points are, if you have a smooth implant, you cannot ever say that your risk is zero, but it's about as close to zero as you can possibly get. This is really a cancer that is recognized in all of plastic surgery literature as happening with a textured device. Mm-hmm. So having a smooth implant, I'm not going to say it completely negates it, but it can almost bring that risk down to zero for this particular problem. The other thing that is important to note is, Chris mentioned a 1 in 9,000. I think you will see numbers as high as 1 in 3,000, but we already talked about earlier the problem with trying to get a real risk is that denominator, right? We don't know exactly how many women in the world have implants. Even in a given population, it can be very difficult to estimate how many women have breast implants. And so what we do know is that this presents as what we call, as Chris mentioned, a late seroma, a late fluid collection. And we know that only about 0.1 to 0.2% of women will have a late fluid collection. And by this, we mean greater than a year after implantation. Specifically, ALCL develops about 8 to 10 years after implantation. And so we're talking in that 8 to 10 year time range. 0.1 to 0.2% of women will get a late seroma, and only about 8% of those women will be diagnosed with BIA ALCL. And so again, you're hearing all these numbers, but the point is it's extraordinarily low risk, and the majority of plastic surgeons will never put enough implants in their lifetime to see a case of BIA ALCL. So the majority of plastic surgeons will never see a case.
It's just rare. So there's nothing that you can do as far as like eating your diet, exercise to prevent it? No. It's just one of those things?
No, it's like I said, it's the stimulation from the texturing. The more aggressive texturing is more stimulation. It's kind of like getting sunburned every day. It's going to lead to skin cancer. So the more aggressive that it is, the more the reaction. One interesting thing for patients to also rest on, not only in my hands and Dr. Rebowe's hands, is smooth implants, almost what we're going to use most of the time. The United States is a smooth implant country. Yeah, the rest of the world has almost always used textured implants. So this number changes obviously by the month or year, but I think on my last read there have been 479 cases, and these have been worldwide. Very few in the United States because we tend to use smooth implants, but Europe, Australia have had most of the cases. Now, I did start to use more textured implants as the gummy bears that people hear about, and the shaped implants came out. All shaped implants have to be textured. They're shaped so that they're shaped like a teardrop of the natural breast. If they're not textured and a smooth implant can spin in your breast all day long, and you would never even know. But if a shaped implant spun, it would look terrible. So there is not a shaped implant that is not textured. So I do love the shaped implants, especially in my reconstruction patients, and have put in quite a few of them. Now, just fortunately, I tend to prefer Mentor brand implants. And Mentor is far, far lower risk. Like I said, Allergan is 6 times higher than Mentor. So there is a risk, but with the Mentor, the number is closer to 1 in 40,000 lifetime risk.
All right, so they're pretty safe.
Yes.
Very. In terms of the safety of implants, I just have a quote to read from Rod Rourke, and Rod Rourke's name probably doesn't mean a whole lot to the general population, but he's sort of like the LeBron James of plastic surgery. He's the editor of our journal. He's a very big name in plastic surgery. He had this to say in July of this year on his most recent, or one of his most recent articles, just called Silicone Implant Illness, Science versus Myth. And what he said in that paper is, at the present state, there's overwhelming evidence to support the safety of silicone breast implants. Ultimately, the decision to obtain, keep, or remove breast implants is the choice of the patient. So, I would just say that even the biggest names in plastic surgery still think that breast implants overall are safe. And this is after undergoing the most scrutiny of any other medical device likely in history. I mean, breast implants are probably the most studied medical device in history because they are so common. And these are people who are absolute leaders in the field of plastic surgery. And, they have evaluated all the evidence and found that they're overwhelmingly safe. And so I think, again, it's important to talk to someone who is well-trained in plastic surgery and who really has a good experience in putting these devices in before moving forward with either putting them in or taking them out.
And make sure that you go to a good plastic surgeon.
That's right.
Some people want to save money and go to back streets. Don't do that.
Yeah, I mean, certainly the budgetary type of plastic surgery where you travel, may not even be a real plastic surgeon. Certainly you're not going to ever see him again. Even if you go back to the same clinic, that doctor is probably not going to be there. So absolutely 100% support that statement. I mean, we are physicians first. I mean, we're here to take care of our patients first and foremost, even put concerns of theirs. We try to address everything and make patients feel better, happier, and healthier.
Even if you look at, our company mission goals or mission statement, I mean, the number one thing is patient safety. From the moment you step foot in our office to the moment you leave, our primary goal is your safety, no matter what you're coming in for. And this is not that uncommon that people come in to see us for stuff that, they may think a plastic surgeon takes care of, but maybe it's not exactly something. But we try to make sure that everybody is absolutely 100% safe from the minute they step foot in our office to the minute they leave.
Dr. Park, for anyone who even thinks that they may have some type of symptom to lead to cancer with a breast implant, how do they get in touch with you?
We'd be happy to see them, whether we did their surgery or not. I mean, have you come in. Hopefully you have your records so we know what kind of implant it is. We'll do a physical exam. If you have, but you should be seeing a plastic surgeon every year. We know that's not realistic, but in that situation, come see us. And we just schedule a consult via the phone, 251-340-6600, website, mprsd.com. Email me directly, Dr. Chris Park at gmail.com, Dr. Rebowe at gmail.com, and we'll forward that to the schedulers if we need to. However, it's easy for you to get an appointment.
Yeah, I think that's the biggest thing that, we sort of want to put out there about this is that, I think that you have to go to somebody that really understands the body of knowledge on breast implant illness, and sort of what needs to happen from the moment you step foot in the office to the time you leave, in terms of not just, working you up for this, making sure you're seeing the right people, but understanding all your options for explantation, reimplantation, things like that. So that was part of the reason that we wanted to talk about that particular issue today.
Doctors, thank you so much for coming out today and answering all our questions. We appreciate it.
Absolutely, no problem.
Thanks for listening to Plasticos Podcast. Please follow us on our Facebook page, and please rate and review Plasticos on iTunes and anywhere else you get your podcasts. This really helps others discover this show. Have a plastic surgery question you want us to talk about? Contact us on our Facebook page or email me at drpark@mprsd.com. That's drpark@mprsd.com. Plus, we really want to hear what you think about our episodes, so let us know. Thanks again for listening, and remember, insist on credentials, invest in results.